Today I will be discussing memory and dementia. Dementia is characterized by a widespread impairment of memory. Our non-declarative memory is our memories for learned procedures, so how we know how to drive to work or make a sandwich. These are built into our motor memory. Our declarative memory is our memories of facts and people and different things that have happened in our lives that we need to be able to retrieve from our long-term memory to verbalize. This is affected first in the early stages of dementia and is the most significantly affected. In the early stages of dementia, a person's ability to remember past events and remember to do things at certain times is affected. We also begin to see problems with their word retrieval, so those circumlocutions during conversation. They also have difficulty remembering things that they've read or heard. In the middle stages, we notice that the memory impairments are becoming more severe and are significantly impacting their daily life, yet their knowledge of their impairments is decreasing. And then in the late stages, people are no longer able to participate in therapy or use any of their learned strategies, so more focus is placed on helping the caregiver. Because declarative memory is affected so early on in people with dementia, we want to capitalize on their non-declarative memory to teach them some compensatory strategies. Spaced retrieval is a strategy achieved through interval training, where the clinician presents information to the patient responds, and then time intervals are increased over time. Errorless learning is combined with this strategy in that we want to maximize the amount of repetitions the patient has during therapy while completely eliminating the errors. Matern, Luzich, and Bond evaluated the long-term effectiveness of once-a-week spaced retrieval training sessions and the relationship between the successful use of the strategy and each client's cognitive abilities. This research was conducted using a one-group pre-test post-test design with 13 dyads participating who each resided in their own homes where all of the treatment took place. Each participant was administered the MMSE, the RBANS, and the RBMT to establish their current levels of cognitive functioning. Baseline data was then collected on what information each participant wanted to learn and what activities they would participate in during the time intervals. Treatment consisted of 6 sessions of spaced retrieval training with the goal for each patient to retrieve information after a 20-minute interval. Their recall was then assessed immediately after intervention, and then 3 months follow-up and at 6 months follow-up. The caregivers were also questioned to see if the client was still using the spaced retrieval strategy appropriately. Results showed that 12 of the 13 participants could successfully recall the information at the post-intervention session and were still using the strategy appropriately. 7 could recall the information after 3 months and 5 after 6 months, all again while still using the strategy appropriately. Post-intervention RBANS scores didn't reveal a significant difference in cognition between baseline and the 6-month follow-up, but the researchers confirmed that better memory scores definitely led to fewer trials needed to reach the interval criterion. They also confirmed that the spaced retrieval strategy was effective and that the once-weekly sessions were effective and convenient for the participants. Hopper, Drefts, Bales, Tomoda, and Danu looked to see if there were differences in ability for individuals with dementia to learn information depending on the activities they participated in during the intervals. They compared the number of sessions it took to learn new and known face name associations under different interval conditions and to see if there was a relationship between diagnosis severity and their ability to recall. This study used a one-group pre-test post-test design with 32 individuals participating. Prior to treatment, they were given a thorough cognitive communication evaluation assessed using the MMSE, the Alzheimer's Disease Assessment Scale Cognition Subscale, and the Functional Linguistic Communication Inventory. Participants were presented with unknown pictures of a male and female who were given generic names as their new information and 2 pictures of celebrities as their known information. The one-to-one sessions were videotaped, occurring 4 days a week with a maximum of 10 training days for each association. The participants were presented with 1 target picture at a time until successful criterion was reached. They were prompted for an immediate response, and then interval time was increased over a fixed schedule. During the interval time, patients participated in one of two conditions. They either read facts and answered questions related to the people in the pictures, or read facts and answered questions about things unrelated to the pictures. Each participant experienced both conditions. The target goal was for the participants to recall the face name association successfully at least 24 to 30 hours after the most recent spaced retrieval training session. Their retrieval was then tested again 4 days after the spaced retrieval training, then again at 2 weeks, 3 weeks, and 6 weeks post-intervention. Results were determined to have a 100% inter-rater reliability score. Out of the 32 participants, 23 of them learned all 4 face name associations within the 10-session maximum, with the known associations being learned much quicker. The most successful retrieval occurred 4 days post-intervention, with the number of recalls gradually decreasing through to the 6 weeks post-intervention session. The researchers reported that there was no difference in the interval activity conditions, so whatever activities the patients participated in during the interval time had no effect on their ability to retain the information afterwards. The only significant cognitive information discovered was that as the individuals' MMSE scores declined, it took them longer to learn new associations. Bigas and Bourgeois looked to see if spaced retrieval, when paired with an external visual aid, was an effective way to teach people with dementia to use swallowing strategies. It didn't teach the swallowing strategies, but rather taught the participants the spaced retrieval strategy to remind them to look at their external aid. A one-group multiple baseline design was used, and 9 people diagnosed with dementia and dysphagia participated in the study. They were pre-assessed for their oral reading abilities to make sure they could read the visual aids, and a review of their video fluoroscopy reports confirmed their dysphagia diagnosis and that they had been taught compensatory swallowing strategies. Each participant was re-educated on their strategies and were given their own external visual aid with the appropriate eating and drinking strategies they would be using during training printed on them. Each participant performed their eating and drinking sequence 3 times with no cues and no external aid to establish a baseline. And once that was established for the first behavior, their card was reintroduced with only the first step, and the spaced retrieval training began for the first response. The time intervals were increased after each correct response, and each incorrect response resulted in a redirection to the external aid. After the first behavior was mastered, training began for the second behavior, and then so on until the client mastered the ability to remember to refer to their card. 1 week and 4 week follow-up sessions were held for each participant to determine if they were still using their learned strategy. Results showed that all the participants were able to refer to their visual aid 93% of the time at both the 1 week and 4 week follow-up sessions. And overall inter-rater reliability percentage was at 91%, making the results reliable. Inter-observer ratings also confirmed an increase in the correct performance of each participant's target behavior since baseline, which confirms that spaced retrieval training combined with an external aid is successful intervention strategy. I found findings to be pretty comparable among the studies. They proved that people with dementia are definitely capable of learning both old and new information under specific conditions. Spaced retrieval is definitely an effective strategy to teach these individuals to recall specific information, and that when we combine the training with the errorless learning and the visual aids, we're giving our clients more success and also taking some of the burden off of their caregivers. It's best learned in the early stages, with each study recognizing a clear relationship between cognition and retrieval abilities. And better memory and better cognition are definitely associated with a more rapid acquisition of the spaced retrieval strategy. So the earlier we begin the intervention, the more effective the strategy will be long term, and the more likely the strategy will hopefully be sort of ingrained into their procedural memory, so that they might have a better chance of being able to access those strategies later in the later stages. We need to keep in mind that each patient is different and that their motivation to learn a piece of information is also highly correlated with success. Again, remembering that this isn't a solution, but a compensatory strategy that is improving each individual's quality of life for as long as possible.